welcome to a very special webinar in conversation with Ukraine's healthcare heroes hosted by World Telehealth Initiative. I'm Laurel Tarleton, the Communications Associate here at WTI, and I'm so excited to be your host for today's session. Our webinar will be about 40 minutes, and we're thrilled to have you with us today to hear some incredible stories and experiences from three very special guests who are championing digital health to bring care to those affected by the conflict in Ukraine. And throughout the webinar, please feel free to post any questions you may have in the comment section. Our team will be monitoring it and will address as many questions as possible. If you're watching in full screen mode, you may need to exit full screen in order to see the comment section. And for our first segment, we have Dr. Anton and Dr. Vadym, two incredible physicians who have revolutionized virtual care in Ukraine to bring healthcare access to people in need and support providers across the country. WTI has worked with Dr. Vadym from the Ukraine Ministry of Health to dispatch and set up a network of telehealth support at 26 hospitals and health outposts across Ukraine. And Dr. Anton has been a critical partner in this effort as well, working with hospitals and providers across the country to jumpstart each program and educate providers on how to use the technology and so much more. And later, we will have an incredible opportunity to hear from Dr. John Holcomb, a renowned combat trauma surgeon who supports Ukrainian providers with complex trauma surgery cases through WTI. And now for our first segment, let's welcome two dedicated healthcare champions in Ukraine, Dr. Anton and Dr. Vadym, as well as World Telehealth Initiative's co-founder and CEO, Sharon Allen.
Thank you, Laurel, and good morning, everyone. Today, I have the pleasure of chatting with my friends, Dr. Anton and Dr. Vadym. Before the webinar, I was just reflecting on our first call, I think it was in March of 2022, and I clearly remember Anton in a green t-shirt, unshaven, he's a little trimmed up now, appearing tired, yet the commitment was undeniable. So now, clothing has changed with passing meetings, but Anton, your strength and resolve have remained firm throughout. And then Vadym, your role in the Ministry of Health has obviously been crucial. And with so much on your shoulders, you've been able to lead from a point of knowledge as well as the necessary flexibility in these turbulent times. But you've never lost focus on finding the best solutions to help the people in Ukraine access critical health care. So as our work and friendship has grown over the last couple of years, I'm hoping the two of you can share a bit about your experience with our audience. So Anton, spending time with both of you in Kyiv and visiting your hospitals in early 2023, I was able to see the conflict's impact firsthand. But can you describe for our viewers how it's affected you and your colleagues as healthcare providers?
Yeah, hello Sharon, nice to meet you, nice to be here today. First of all, I want to say that when the war started, if you remember, I'm living in Kharkiv, it's the city near Ukrainian-Russia border. Most of my colleagues, they was relocated from Kharkiv to other Ukrainian cities because it was so scary to be here in the first day of the war. And of course, we had some difficulties with our patients because it is very difficult to be in touch with our patients. And I think that this war was like a launching of telemedicine in Ukraine, because in that time we started to be always on our mobile phone with our patients. So we started to use different applications like Viber, like Telegram, like WhatsApp. And in the days we was always in touch with our patients and with our colleagues. Then when most of us was located to different cities, we started to work with different clinics, and then we met with you, with Teladoc, and we started to develop our telemedicine system network in Ukraine. And I believe that it's a very good launching project, and that's despite of this war, we are going to be the best country in the world with our telemedicine system, because I know that we have very big number of teledoc robots in Ukraine right now. So I believe that our project is so very good, and we are we are going to be the best.
I agree. Thanks, Dr. Anton. And Dr. Vadym, how did the implementation of telehealth enhance patient care and access to specialized medical experts from our international experts in Ukraine?
Thank you, Sharon. Thank you for invitation. First of all, I would like to present myself. I am Vadym Terentyuk, MD, PhD. I am a lead of telemedicine direction in a state enterprise, and at the same time, I am secretary of interdepartment work group in Ministry of Health who develop telemedicine in Ukraine. First of all, I would like to say that our cooperation began in March 2022. At that time, we have a lot of telemedicine offers, but the vast of majority of our partners did not understand our needs. We had ongoing hostilities, and there were a lot of wounded among the military and the civilian. The offers were very different. Our partners, you from VTI, explain us how to use the telemedicine decision in the best way. It was a very crucial, important, because the international experience release us to knowledge how to use and how to treat our patient.
Thank you, Vadym. I do remember those early stages, and when there was all sorts of concerns, like how do we know who has access? And you wouldn't want individuals beaming in unauthorized and seeing who's in the hospital and creating security issues. And then there was questions about the signal and how to mask that from the electronic devices so they can't be detected, and all sorts of issues that we were both working through in order to implement this as quickly as possible. So again, you were a fantastic partner, and that's why we were able to accomplish so much so fast. And then maybe you can share an example of, early on you had requested combat trauma surgeons and as well as other expertise from our international network of providers. Can you give me an example of one case that stands out in your mind?
Sure. Right here, absolutely. That the VTI bring us the complex decision for the telemedicine consultation. It's very important. That, as you say, it's one decision for the different questions, and the security and the connection and the experience of professionals. For example, as you remember that first consultation were from the United States for the combustiology trauma. It was a Dr. Holcomb to consult us for injured soldiers, because there are not experience in our countries, so a lot of experience that Dr. Holcomb consult from the United States, our hospitals, first of all in the Lviv, in the Kiev, and then Dr. Holcomb came to the Lviv and consult our other hospitals. So it's a good example for the coordination between different hospitals. The second example is the consultation with the Dr. Mendes from the Canada in the neurosurgery. So as you understand, the combat trauma, a lot of combat trauma in the neurosurgery trauma. And we have some doctors who leave our hospitals, they go to the front line, and we have no enough and experienced doctors. In this case, show us a lot of benefits from this consultation, from this telemedicine consultation.
Thank you, Dr. Vadym. And Dr. Anton, do you have any particular case that stands out with international expertise that WTI connected to your providers in Ukraine?
First of all, I want to confirm that case that Vadym described, because it was very helpful for our doctors. And I know that Dr. Hook from Institution of Neurosurgery in Kyiv, he is in touch with that huge Canadian neurosurgeonist, Dr. Mendes. So he's able to ask him directly if he needs some help with his heart patients. And I can say that one of the best positions in telemedicine in Ukraine is for today is using of this robot that were donated by WTI in Donetsk region, because lots of doctors from Donetsk region, they moved from here to Lviv, to Kyiv and other cities. And I can say that statistics says that we have near 100 consultation per month from Donetsk region. And I think that's really a huge number of teleconsultation with that equipment that were donated to Ukraine. So I think it's really very helpful for our peoples, for our civilians, and for our military people.
Thank you. And so both of you spoke a bit about Dr. Mendes supporting Dr. Hook. And I remember him saying there was some procedure that they had heard of, but they had not done before. And it was a bit complex. But with the guidance from the experienced neurosurgeon in Canada, he was able to guide them where they had the confidence to do it. And it did have a good outcome for the soldier. So it was, that type of collaboration is exactly, the benefit of telehealth. So thank you for sharing those stories.
I believe that was very helpful, and I want to believe that we will use that contacts in the future, not only in wartime, but after our victory.
Let me say several words about this case, and it case have continued because Dr. Hook, he goes to the military hospital now, and he would like to take this robot to the military hospital because he understands the importance to cooperation between the Canadian doctors, American doctors, and exactly with Dr. Mendes, that it will be new cooperation. It will be exchanging experience, because now in Ukraine we have a lot of injuries that have never been seen in the world, in the United States, in the Canada, and now this is a next level of cooperation due to telemedicine decision.
It was interesting that the conference that we attended recently in Poland with the study of of modern day battlefield telemedicine and how that has grown, and there are new challenges and how we address them. I think there are lots of learnings. Like you said, Dr. Vadym, there's things that we haven't seen before in past wars that we're learning how to deal with and address. So again, thanks for sharing that. And then Anton, I'll throw this one your way. I don't know if you remember, but I certainly do, when the missile siren went off on our first morning together, and you calmly explained if and when and how we would move to the shelter. And I was struck by the juxtaposition of trying to carry on with one's day, yet keenly aware we are in an active battle zone. And I believe part of the challenge in Ukraine now is the fractured infrastructure that you have to navigate. So maybe you could tell us, how has WTI's program facilitated collaboration and communication among healthcare providers experiencing these challenges within Ukraine? And maybe you can share an example of that.
Yes, first of all, I want to say that we need to live. Because if we think that because of war our life has been stopped, that's one direction to depression. So you need to live. You need to think that life is here, life is now. So that's the best way to survive, I think. Regarding to WTI and telemedicine, I can say that this project help, for example, me to have lots of collaboration with others doctors. For example, Dr. one of the best neurosurgeons in Ukraine. Yes, he is living and working in Kiev, and I've never heard about him before this program. Now I can call him and say, please, Dr. Hook, I have a patient for you. Please consult my patient and help me with that big problem. And because of that problem, I have a very big number of doctors who could assist me with my patients, first of all. And it's really big collaborations between Ukrainian clinics, for example. As you remember, we have sub-project in the Kiev region where we have Dr. Dzuba. He's the main anesthesiologist in the Kiev region. And he's covering all Kiev region, all small hospitals in different small cities of Kiev region. And that small hospitals are able to ask Dr. Dzuba to beam into their robots, and he can tell him what they should to do with that patient. I think that's really helpful. That's really one of the best way to assist doctors from Kiev, for example. Yeah, and that's I have no words how to describe this because it's really helps to survive people's lives, and that's it, I think.
Well, thank you, Anton. And I know that you moved during the conflict, and as many people were displaced for, maybe still are displaced, or certainly for a period of time. So the way that telehealth can connect you to your colleagues, and they can still help, each other, no matter where you are in the country, with this network of devices and post the worst.
Not only in country, Sharon, yeah, because we know that if we're speaking about telemedicine, you are able to beam in the robots from different places in the world. You need only internet access. That's it. So
that's right.
You're able to beam into Kiev robot, to Kharkiv robot, etc., etc. So it's really cool.
It is really cool. Vadym, maybe as a closing question, so on the heels of the eHealth Summit that you just hosted, how do you envision continuing leveraging telehealth to address healthcare challenges in Ukraine? And tell us what you hope for the future of telehealth in Ukraine.
Thank you. Thank you, Sharon, for the great question. This is question in the same time and easy and difficult. Easy because we all together in our country who implement the digitalization in the healthcare understand telemedicine is the future of communication between the professional in the healthcare and communication with the patient, because we are living in the digitalization world. This is the first easy answer. The difficult to implement it on the high level, of course, but you help us. You bring the VTI brings us the experience and culture. I talk that frankly say that we have a lot of vision before war and before our communication. Your communication and communication with our international partner have changed our vision for the telemedicine for Ukraine. And telemedicine in Ukraine must be part of our health system. And now I am proud to say that we are prepared, the law regulation and all decision for the implementation in Ukraine. We would like, with our team, with our professionals and our politics lead, to implement the telemedicine as a routine part of professional work. It means in the future our patient can choose to go to the hospital by walk or take a telemedicine consultation. Of course, it's a very complete and scale question, and I cannot answer it for the all question at the same time. But I am sure that the telemedicine will be part of our health system in Ukraine.
Thank you, Dr. Vadym. So, Dr. Anton, Dr. Vadym, it's been, I would say, an honor and a privilege to stand with the resilient healthcare professionals in Ukraine at such a critical time. Your unwavering dedication to ensuring access to care, even in the most challenging of circumstances, is so inspiring. And at World Telehealth Initiative, we're proud to work alongside you. And together we'll continue building bridges of support and healing within and across borders. So I want to thank you for your partnership, your courage, and for reminding us all about the power of collaboration in the face of adversity. So Slava Ukraini, thank you.
Героям слава!
Thank you so much, Dr. Vadym and Dr. Anton, for such an inspiring conversation, for sharing your time with us, and for your unwavering commitment to healthcare in the face of adversity. And for our audience, Dr. Anton and Dr. Vadym will be sticking around to answer questions at the end of the webinar. So if you have any questions for them or Sharon, feel free to put them in the chat and we'll get to as many as we can. And next, we have an exclusive interview with esteemed combat trauma surgeon, Dr. Holcomb. Since the outset of the conflict, Dr. Holcomb has dedicated his time and shared his expertise with colleagues in Ukraine to help with the large influx of combat casualties. He and his team helped update the Ukraine's hemorrhage protocols to save more lives, and he continues to support Ukrainian providers through telehealth with WTI's program. And Sharon recently had the opportunity to interview him, and we're so fortunate to carve time out of his busy schedule. So today we're excited to share that interview with you.
Good morning, Dr. Holcomb. Thank you so much for joining us today and sharing about your work in Ukraine. Before we get started, maybe you can just introduce yourself and give us a little bit of your background for our listeners.
Oh, happy to do that. It's great to see you again, Sharon. It's great to be here. So I'm a trauma surgeon. I spent 23 years in the Army, retired a long time ago in 2008. And since then, I've been kind of an academic surgeon working in large civilian trauma centers. Over the last 2.5 years or so, I've had the opportunity to go to Ukraine 5 times, as recently as last week, helping in many different ways.
And also, how did you get involved with World Telehealth Initiative?
Yeah, so in early in 2022, after the Russian terrorist state invaded Ukraine, I got a phone call from an ex-Army friend of mine who also was a retired colonel, and he said, "Hey, will you send me your PowerPoint slide on blood product resuscitation?" I said, "Of course." And then a day later, he called up and said, "Why don't you just come over and give this presentation?" I asked my wife, and she said, "Okay." And 4 days later, I was in Ukraine. So back in I think May of 22. You know, my experience with telemedicine actually goes back to 1993 in Somalia, where we used a telemedicine, a very primitive at the time telemedicine platform. And we've been interested in telemedicine since then. And when I got to Ukraine, discovered that they're fairly robust and fairly active in telemedicine, and WTI is obviously a big part of that. So the civilians who received thousands and thousands of combat casualties were really unfamiliar with the military wounds, burns, large wounds. And that's where we spent a lot of our time kind of imparting the knowledge gained from 20 years of war in Iraq and Afghanistan to the civilians that were seeing thousands and thousands of combat casualties.
Can you share maybe a specific case where your guidance directly impacted a patient's outcome?
You know, I think telemedicine, telehealth is actually very interesting. In my opinion, it works best if you've established a relationship with the folks on both ends, right? There has to be an element of trust that goes back and forth when you do telemedicine. And so the opportunity to work with, operate in, understand the supply issues, the healthcare system in Ukraine, and then had the opportunity on several patients. One that really sticks out is a young soldier who had a devastating intra-abdominal injury and was in Lviv, which is in Western Ukraine, several weeks after injury. And we rolled the telemedicine, I call it a robot, but it's not a robot, right? The thingy to the bedside. And I was able to sit here in Houston, Texas, and on my phone with that WTI device at the bedside, look very carefully at his colostomy and look at his wound and look at the granulation tissue. It was pretty amazing, the camera ability to go in and out, to look at the whole patient and then to look very closely at the wound and then talk to the clinicians at the bedside who I had operated with and rounded with and broke bread with a couple of weeks earlier. So I hope that improved the care of that patient and helped move his care along. And really was facilitated. It would have been impossible actually without the WTI device. Yeah, the camera, the ability to pan out and look at the whole patient and then to pan in and look at a wound very closely actually was remarkable.
I want to recognize your unwavering dedication to saving lives in such challenging circumstances. I mean, to me, you're a modern day hero. And I thank you for sharing your time with us today.
Sure. Well, those are very kind words. As I think I've told you before, it takes big teams of people, right? And I would just, comment that the work that you've done in your leadership role in WTI around the world, not just in Ukraine, but around the world is phenomenal and allows folks like me to communicate and talk and share information at the WTI platform is incredible.
Thank you so much, Dr. Holcomb.
Take care.
Thank you to all three of our amazing webinar guests for your dedication to supporting Ukrainian healthcare providers and patients despite many obstacles. We're so fortunate to have you as partners and that you were able to share your time with us today. And now we have Dr. Vadym, Dr. Anton, and Sharon here to answer any questions that you may have. So if you have a question that comes up, please feel free to put it in the chat. And our first one is a question for Dr. Vadym and Dr. Anton. It says, during the early months of the war, I and many other US physicians signed up with different telehealth platforms to provide free virtual primary care within the borders of the country. For many reasons, these well-meant efforts didn't work out. Is there any need now for virtual medical consultations or care from foreign volunteers? And if so, how should that work?
May I answer?
Yes, please.
Thank you. Thank you for your question, and thank you for your desire help and real help. And yes, this is true. The first months of our big invasion, we have received a lot of offers for the consultation abroad from the United States. Instead, it was we have a big difference in the time period, and we have the border, the language border. So first of all, in that time we have another regulation, and we are democracy country, and first of all we should go to the rules when we prepare the consultation for our patient, and it was a big problem. During the first months, we have changed our law regulation, the higher level, that the consultation for our patient will be possible from the United States sides, from the doctors from the United States. And it was the first big reason that the most part of offers cannot work at the first. The second, it was the language barrier, and we understand it, that the most patient of Ukraine can speak English. And next, I think will be a different vision for our situation from the United States in the first day of invasion, and the real situation of our patient and our doctors in the Ukraine. Now we break these barriers, and using the teledoc decision exactly, we can create the absolutely understandable consultation. And I would like to say that the most effective consultation now, this consultation between the hospital, between the specialists, because they talk on the same page. Thank you for your question again.
Thank you, Dr. Vadym. Okay, we have another question for any of you, which is, based on your experience in Ukraine, do you envision using the same strategy for others, disasters, wars, or urgent needs?
I can answer. Thank you for your question, first of all. We using different strategies because, first of all, we have different telemedicine projects here. And we decided to make some projects. For example, first is convertiology, the second is rehabilitation, third is therapeutic patients, and one of the main and successful our sub-projects is using of teledoc robots in Donetsk region, where we have successful 50, 70 consultation per month. So for each clinic, for each region, we have different strategies because it's really helpful, and it's helps not only for our doctor, it helps for our patients.
Thank you, Dr. Anton.
Yes, I would like to add to my colleague Anton that it's really today we have a good experience to use telemedicine during the war. I'm sure that this experience is very interested to our colleagues from the United States because it's new war in the world. But what we understand that we should focus on the problem and looking for the tools for the solve this problem using the telemedicine decision. It's maybe different decision. For example, as said Dr. Anton, that it maybe for Kramatorsk, the direct consultation. For example, for our clinic that are located in the central of Ukraine, it needs to combine the teleconsultation with the access to the medical data. So one thing it's common for the all cases that new technologies and telemedicine it's at a value for the consultation.
Wonderful. Thank you so much, Dr. Vadym. And we have time for one more question. So the last one is, what was the most surprising thing you learned during this experience of setting up the telehealth support network in Ukraine?
Sorry, for my personal opinion, was very surprised when the first day of the invasion we received the some letter from the world telemedicine initiatives to implement the telemedicine decision. In that time, I really did not understand how it will be used in our situation. It's a very critical situation because we had a lot of explosion and we don't understand how we can use. But after several hour conversation about virtual meetings, we understand that our colleagues from other side, from the United States, have a lot of examples and experience. First of all, it was a big experience how it will be implemented in our situation, and I will be honored to meet you first time, the Sharon and the Dr. Holcomb, and it gives us the strong to implement the telemedicine in the future.
I can do my addition. I was surprised that doctors from USA, from Great Britain, was ready to come to Ukraine in the start of the war and assist us, make some lections for us. And the second my surprise was that our Ukrainian doctors are ready for telemedicine. It's really gets to make some simple things, and it's make the time of therapy more short, because you don't need to go to clinic at night, for example. You can use telemedicine decision and decide the question from your flat. That's really perfect, and our doctors really are ready for that.
Yeah.
Wonderful. Thank you so much, Dr. Anton and Dr. Vadym. It was such an incredible opportunity to have you both join us for this webinar. That's all the time that we have for questions, but your answers were so insightful and very exciting for our audience to hear from you. So thank you. And to anyone in the audience, if we didn't get to your question, don't worry, we'll make sure to address it via email. And that concludes our webinar for today. We hope you enjoyed today's session. A recording of this webinar will also be available on our website, so you can go back and reference it or share with others if you'd like. And thank you so much for attending, and thank you for your dedication to expanding healthcare access. We look forward to seeing you at our next webinar in the new year.